Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of Super Talk Mississippi Media, and today's special guest is ER physician Alex Hampton. Dr. Hampton, thanks for joining us.
Thanks for having me.
So today's topic is going to be strokes. Tell me, what is a stroke and what are the different types of strokes?
So stroke is just any time that your blood doesn't get appropriate blood flow that it should. It can cause issues with your gait, it can cause issues with speech, and there's many different types of strokes, particularly two that we tend to think about. We call ischemic, or that's when you have a clot going to the brain, and then we have hemorrhagic, which is when you have bleeding on the brain. Both can cause significant damage to the body. We also think about TIA, or mini stroke, and that's the same thing as a full-blown stroke, except it doesn't last for 24 hours. It completely resolves.
What are some risk factors that predispose someone to having a stroke?
So people that tend to have strokes, let's just be real, strokes can hit anyone from children all the way to the elderly, but generally you're thinking of someone that's got high blood pressure, diabetes, cholesterol, maybe they're a smoker, a family history that predisposes them to that, someone that has coronary disease, particularly atrial fibrillation, increases your risk of clots. Anyone that's got a family history of aneurysm can have bleeding on the brain, so that makes you high risk. And the smoking also can increase that risk.
What are some things that we look for when we're concerned about a stroke?
Time is brain when we think of strokes. So I like to use the mnemonic BFAST, B-E-F-A-S-T, and B stands for balance. We think of getting sudden onset dizziness and just having difficulty walking, where you're ataxic, almost drunk appearing. E is going to be your eyes. Are you losing vision in one or both eyes? Do you have double vision or blurry vision? F is going to be facial droop. Do you have that droopy smile? A is going to be, do you have any weakness in your arm or leg? We call that arm drift. S is going to be your speech. Do you have slurring of your speech? And T, definitely not last, is going to be time. Time is of the essence. We lose about 2 million neuron or brain cells every minute that we're not getting adequate blood flow, so that's super important.
So be fast. I'll be sure to remember that. Thanks for joining us today. Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from providers at MRHC in Corinth.